Good afternoon, ladies and gentlemen. My name is 𝐂𝐨𝐦𝐬𝐧. I am the CEO of a company called the HaloCare Group, and we are based in the Republic of Ireland. I'm just going to step you through a little bit about our company. It's very in tune with some of the other panel speakers that we've heard throughout the day. Who our people are, what our mission is, what are the challenges that we're trying to solve in healthcare, and how HaloCare works. How does it work in action? So our mission is to empower senior adults to live, and those with chronic diseases, to live independent lives in the comfort of their own home. We use supportive technology, remote monitoring of patients in order to do this. We have a very strong team that have together probably about 70 years in healthcare across the globe. I myself have been in the Middle East, and I was actually here in Malta as well over the last 10 years. I trained as a nurse, a critical care nurse, and very soon became very disillusioned with healthcare, and patient-centred care were kind of bandied around terms that we had for years. The challenges that HaloCare is trying to solve, obviously we're not the panacea for everything, but there is a place for digital technologies and remote patient monitoring. And then what's the market opportunity? And as the previous panel were talking about, the data, the patients saving lives, what does that actually look like? And then how we actually do it. This is my team. So my three co-founders, David Walsh, Niall Kelly, and Dr. Johnny Walker, are EY Entrepreneurs of the Year. They're serial entrepreneurs. And about 2 years ago in Ireland, our Prime Minister put out a call and said, look, we need a service. We need the private industry to come up with a solution to support older people that were socially isolated, living in their homes in the middle of lockdowns of COVID. They put together a board of clinicians. Dr. �W𝐞𝐝-𝐻 in particular is the first female master of the National Maternity Hospital in Ireland. We have geriatricians, we have surgeons. Claire Harney actually drafts the regulations on digital technologies for the EU. So we have a stellar clinical and social advisory board. We also have a commercial advisory board, which is made up of industry leaders across the UK and Ireland, also EY entrepreneurs. So I'm really overburdened with EY entrepreneurs in my company, but I have incredible support. As I said, I started off my career as a critical care nurse, and over the last, I suppose, 10, 15 years, I was involved in transformational projects, commissioning new hospitals, redesigning services, but it was always around the acutes, what suited the acute hospital rather than what the patient had to go through and their journey. So your patient turns up to, let's say, pre-op, they have to go and get their bloods, then they have to go to x-ray to get their chest x-ray, then they have to come back and see the consultant, then they have to go home, and then they've got to come back in for some more tests. And it was really all around that. How does that work? The pre-op, the post-op, the surgical wards, the theatres themselves. And then I realised about 2 years ago when COVID hit, the adoption of digital technologies was rapidly deployed across the world because we had no choice. So you had electronic records being, deployed across, for instance, I was in Dubai. So all 7 Emirates had an electronic record within a month. So we had, respiratory type devices being put out into the houses to monitor patients who were COVID positive. And it was just really an incredible opportunity to actually reimagine how we deliver care. I'll go into the challenges now in a while. These are my team here, my leadership team. We've all come from diverse backgrounds, mostly in healthcare though, whether it was in medical devices or actually clinical. So the challenges. So across the globe, as I said, I've spent the last 10 years out in the Middle East, and I have worked with the Canadians, the Americans, APAC region. Everybody is facing the exact same challenges. We cannot manufacture the nurses, the doctors, the carers fast enough. We have a global shortage of a clinical workforce. We're not going to catch up for at least another 10 to 15 years, and even then it won't be at the pace or the demand that we actually need. We have an aging population, which is fantastic. Older people are living longer, but with that comes chronic diseases in the community. So therefore, how do you manage them? And then COVID-19 obviously has exacerbated everything. Across the world, there are waiting lists. In Ireland, where I'm from, we have 850,000 people sitting on a waiting list for treatment in a hospital. We have 5,500 people sitting on a waiting list for home care, and we can't actually meet the demand. So that's why I was saying about reimagining. We can sit here and complain and say, there's nothing we can do. We can't build new hospitals because we don't have the nurses or the doctors. We can't redesign the wards or reimagine how we would deliver care in the hospitals, but we can provide a hybrid model. And that's what I was saying. The digital technologies, as good as they are, they're not the panacea for everything. So you still need to have that interface of the human being with the digital technologies. So how is HaloCare delivered? We have 3 pillars. It's built around safety, which is our activity as well, and it is the social, the wellness, and the clinical pillar. out of each one of those pillars, you can design a bespoke service for each individual patient. So if you have a 75-year-old lady who has early onset dementia, just wants to live at home independently and needs a little bit of support, you could just take some of the services out of our activity and movement pillar. Maybe they suffer from high blood pressure, maybe need to take their blood pressure once or twice a week. So you can design a bespoke service around the individual needs of the person. The benefits. Obviously, the first one is that they get to receive the care in the safety and the comfort of their own home. They can take autonomy for their own care. They can receive it as and when they wish. They don't have to get into a car. You don't have to get your son or daughter to take a day off work, to drive you up to the hospital, park the car, get in to see your consultant, wait around for hours, and then get home again. You can actually have a video call. We all have seen the telemedicine and how successful that has been across the globe with COVID-19. The different areas that we work with in HaloCare, we work with from the acutes into the community, from the GPs to the social and wellness piece into the acute hospitals. So we can work across all the boundaries. So you have a patient who goes into the acute hospital for surgery, and when they're discharged, in a lot of cases, they won't get the discharge letter. So they get home and they get to their GP, and the GP doesn't really know what they had in the hospital. Maybe they've had some surgery, but they don't know what happened, what the post-op care is or anything like that, because electronic records are not available globally yet. Not all countries have them. So what we do is we provide that communication piece. So our platform, our software platform is called Aura, and that is the communication piece. And it is where the patient can actually upload all their electronic records, all their medical data onto it. They own that data. We provide like the repository for them to store their data. So they can go into the acute hospital and they can give access to their consultant of their medical records. They can go home, go into their GP, and they can give access to their GP, and they can take that access away. So they control those data. And this is how we do it, through our Aura platform. We have a state-of-the-art care hub in Carlow that is built to the best of international best practice and standards. It runs 24/7, 365 days a year, and it is staffed by nurses, doctors, and allied healthcare professionals. So that's why we're saying we can build that bespoke care plan around the person's individual needs. We have an incredible team. We have an incredible culture in our organization, which is built through respect and dignity, exactly the same as what we do for our patients, putting the patient at the heart of every single thing that we do, because without them, we wouldn't have a company. And the only reason any of us got into healthcare is because we wanted to make a difference. And how do we do that? We bring those people in with us. With Aura, what we're able to do with Aura is the decline piece. So if you have somebody who's on HaloCare and you can see what the normal is, and our system can read them within 3 to 5 days, it then knows what the normal is for that person. And as soon as the abnormal happens, we can intervene. We can actually catch them before they end up in the acute hospital, before they end up that their chronic disease, whether it's COPD or diabetes, gets out of control, that they can get that intervention, the clinical intervention straight away. So they do not need to end up in A&E, like for instance, something as simple as a senior, an older person, not drinking enough water during the day, not keeping up their nutrition and their hydration, and then suddenly they're dehydrated, they end up on a trolley in A&E, you're waiting for 2 or 3 days on that trolley, and as soon as that happens, they start to decline. I've seen it firsthand when I worked as a critical care nurse in A&E in Ireland and the UK. So that is really what our goal is. Putting the devices in, our devices are microchips. They're tiny. So we put microchips on the back of the microwave, heat sensors on the back of the microwave. We can put them on the cutlery drawer. So all of that data is fed into our Aura platform, and it paints a picture. We call it the day story. We use no cameras, so it's really, really unobtrusive. And it's a very, very discreet, because that was the one thing that my co-founders and we discussed was around, you don't want to walk into somebody's house and for them to know that they've got HaloCare, because none of us want to feel we're getting old. None of us want to be able to, have that label on us. So it's really, really about discreet devices that we source around the world. We call them the best of breed that we bring into the homes of our clients and patients. As I said, I'm coming from a clinical background, so we work with all the regulatory frameworks, all the regulatory bodies. We're actually sitting in Ireland at the moment. We don't actually have a council for digital technologies, a regulator, which was quite shocking when I came back from the Middle East to find that out there. So now we've been invited to sit on the committee and literally design all of the regulatory frameworks for Ireland. These are some of the areas that HaloCare works in. So we can care and support individuals from the age of 18 right up to 100 across a broad spectrum of therapeutic areas. Oh, I'm running out of time. Sorry, this is what I was explaining about the day story. So all the data that comes into us is all paints a picture of an individual's day. We also have a Circle of Care app that the children of the older person, for instance, can actually see their day story every day. So in real-time data, you will be able to see that your mum got out of bed at 7 o'clock, she went into the bathroom at 7:15, she went down to the kitchen and turned the kettle on. All of that is fed in. And the biggest feedback we've got from everybody is that it's peace of mind. So I have to go out and collect my children, I have to go out and do the grocery shopping, but at least I know my mum is being monitored and minded 24/7.